assessment skill appropriate to the assessment of the patient scenario would be an abdominal exam. The patient presents with no abdominal pain, but with the bruising and a slightly distended abdomen. Further examination is necessary. We're going to make sure the patient voids before beginning, sanitize our hands, and provide privacy. Patient lies supine with arms alongside a body. We're going to inspect, auscultate, percuss, and palpate. With inspection, we look at skin condition, scars, bruising, contour, symmetry, visible bulges for documentation purposes. We can put abdomen contour predominantly flat and symmetrical with only slight rounding. No signs of inflammation or evidence of hernia around the umbilicus, without scars, rashes, lesions, pulses, or masses. And now we're going to auscultate for bowel sounds in each quadrant. And then we're going to auscultate the aorta using the bell. And there are no bruits. Documentation purposes, bowel sounds present in all four quadrants, no bruits heard over the epigastrum or the aorta or iliac and renal arteries. Next, I'm going to percuss the abdominal quadrants. And I'm going to percuss for the size of the liver. And it should be between 6 and 12 centimeters. To assess the size of the spleen, we percuss the lower left anterior chest wall in a lateral direction and noting the extent of tympany. If tympany is predominant laterally, then enlargement is unlikely. When tympany persists, then spleen size is normal. When the spleen is enlarged, tympany changes to dullness. As the spleen enlarges into the abdomen, tympanic resonance is lost as air-containing bowel, stomach, and lungs are displaced. For documentation purposes, we'll put tympany percusses in all four quadrants, liver dullness of 8 centimeters heard at right MCL, lower edge of costal margin. Then we're going to palpate the abdomen. We're first going to do lightly, and then we'll do deep. And just let me know if you have any kind of pain as I press. Any pain, sir?
No pain.
We palpate deeper to feel for organ size, position, and tumors. A little bit deeper. And then we're going to palpate the liver. Go ahead and breathe in for me, sir. And then out. A hard, firm liver would suggest cancer. A liver more than 1 to 3 centimeters below the costal margin is considered enlarged. And now we'll do the spleen. And in ordinary circumstances, the spleen is not palpable. And the patient does not experience tenderness. And for the spleen to be palpable, it must be enlarged to 3 times its expected size. Palpitation needs to be done gently because this is a relatively fragile organ that may be ruptured if there is evidence of abdominal trauma. Even if the spleen is not ruptured initially, vigorous palpation may cause it to rupture. So we'll do it gently. Okay, breathe in, sir. And out. In. Out. When we get to the kidneys, they are considered to be non-palpable. An easy, palpable, or tender kidney is abnormal. For documentation purposes, for light palpation, no masses or tenderness in all four quadrants. For deep palpation, no masses or tenderness noted. Liver border, barely palpable at costal margin. Smooth and firm without tenderness or nodules. No tenderness bilaterally. The end.